So I'll come into my patient's room and I'll use the hand sanitizer that's on the wall. And I'll introduce myself to the mom. Hi, I'm Taylor. I'll be your nursing student for today, and I'll be helping take care of you and baby. And I'll ask her if it's okay if I can do an assessment on baby, and if she consents, I'll start my assessment. So the first thing I'll do is I'll check baby's ID band, make sure I have the right baby against the crib card, and I do. So I'll start my assessment. First, I'm going to listen to baby while they're quiet so I can hear everything correctly. So I'll listen to the heart, bilateral lungs, and the bowel sounds. And those all sound good. The lungs are clear, and bowel sounds are active in all 4 quadrants. So then next I'm going to do my vitals on baby. And some typical ranges for vitals and baby respirations would be 30 to 60. The pulse is 100 to 160, and a temp would be 97.5 to 99. They're the kind of the ranges we want to see. And once I get those done, then I'll start my the rest of my assessment. So first I'm going to look at baby's head, and I'm looking for the fontanelles on baby's head, the suture lines, and any molding up here. I'll also be looking for any bruising or scratches baby might have gotten from birth. And then I'm also going to look for subhematomas and caput succedanea. And a hematoma is only going to stay on one side of the suture line, and caput succedanea can move across the suture line, so that's kind of what we're looking for. Just like fluid buildup on the brain, or the hematoma can be blood. And so then next I'm going to look at baby's ears and make sure that they're in line with the eyes, and because low set ears can be a sign of Down syndrome, so that's something we want to note. And then I'll check recoil on baby's ears and just fold the top of the ear down and then let it go, and it should go back into place. And then next I'm looking for the epicanthal fold on baby's eye, and for any discharge or draining that might be coming from baby's eyes. Next, I'm going to check the patency of the nares of baby. So I'll hold one nostril and then feel for a breath on the opposite nostril, and then vice versa with the other one. And then next I'll put on some gloves to assess for baby's palate, and put my finger up to baby's lips, check for a rooting and sucking reflex, and then stick my finger in baby's mouth, and I'll feel for the top of the palate and make sure that it's a full palate and nothing's missing. And then I can take my gloves off. And then I'm going to assess baby's neck, make sure they have good range of motion with the neck, and check for any masses in the neck as well. At this point, I can also check baby's clavicles, make sure they didn't broken during the delivery, or there's no bruising or noticeable amount of swelling around them as well. And then next, I'll check baby's skin. So I'm going to check the skin turgor in either the thigh or on the abdomen. And then noting their just color, so this baby is pink and it's Caucasian, so it's got like a white tint to it. Any vernix that's on the baby, or any bruising or scratches or peeling on baby as well. And then I'll also check for the 5 places of jaundice, which would be the forehead, chest, the abdomen, and the thigh. And then we go back and look at the eye, which is our little rhyme that we use to remember it. Also, while I'm here, I'll look at baby's umbilical cord and make note any drying, and if there's any discharge that's coming out of the umbilical cord as well. And then I can also watch for any respiratory distress that baby's in, and the 5 signs for that would be grunting, nasal flaring, retractions, seesaw respiration, or apnea that's lasting longer than 20 seconds. And any of those things we'd want to note, because those are signs that baby's having some trouble breathing. At this time, I can also do some recoil on baby's arms. So you want to push down and make sure that they come up afterwards, and down. The opposing, if I go up, they should go down. We can also test their Moro reflex, so you can either clap right close to them, or you can even drop the top of the crib, and their arms should go up in a C motion from the noise that is made. Next, we're going to look and make sure baby has 10 fingers, 5 on each hand, and 10 toes, 5 on each foot. And we're going to look for the palmar creases and make sure baby has 2 creases on each hand, and then some creases on the foot. And then we'll also check the Babinski reflex. So we're going to take a tool and we'll go across baby's toes, and then they should flare out. Next, we're going to look at baby's genitals. So we'll undo the diaper. If it's dirty, we can change it at this time. And if it's not, we'll go ahead and look. And if it is a male, we're going to check if baby is circumcised or not. And then we should see if the testes are distended, the rugae that is on the testes, and also if the meatus is at the top of the penile shaft. And for a female, for a term baby, we want to make sure that the labia majora is covering the clitoris and that there's no discharge. And for preterm babies, we're also looking for any discharge, and the clitoris and the labia minor are kind of more prominent in the preterm babies. And then we'll also flip baby over, and we'll check the top of the butt crack and make sure there's no dimple or tuft of hair there. That can be a sign of spina bifida, and they typically need to get an ultrasound to check more into that. And we're also checking the contour of the spine while we're back here, checking for any abnormalities. And then we'll put baby's diaper back on, and we'll wrap baby back up. And then I'll ask mom the last time baby fed, the last time baby had a poopy diaper and a wet diaper, see if they need anything while I'm in here, get them any supplies that they need, and make sure that they're all set to go. And that is my baby assessment.